Thank you very much. So, Chris, I might not give conclusions, but rather different perspectives that were mentioned today. I attended this afternoon's sessions and discussed what was said in the morning as well. So I was surprised by the number of concrete actions that are linking health and environment, adaptation, mitigation actions. How can we act to protect the environment, and how can we thus act to protect health? Many people mention cross-cutting issues, the fact that there can be co-benefits between different public action areas. How can we mobilize citizens, private actors, stakeholders in regions? We heard a lot of examples on cities, local authorities who are being much more active, I think, than the national level. And I'm not talking about Santé publique France here, but sectorial actions. And I feel like cross-sectorial actions are much more efficient at the local level rather than the national and European level. And I'm quite surprised by this, because I'm at the head of a think tank on international relations, trying to reach two ambitious agreements to represent environmental, international, social issues. And I've been working for the Ministry of Environment and this think tank, and I've realized that we need health as a lever to trigger these actions. I feel that when you work for a think tank on environment, you are going to talk about the cost of inactivity if you don't protect environment. We need to mobilize public stakeholders, but also private stakeholders, NGOs, syndicates, trade unions, and the ministry in charge of sectorial policies by using a health-related argument. You can't just act for the environment if it is also about protecting health. So I think that health can be a lever for political mobilization and to be effective at the national and international level. I've just spent 15 days in Geneva to negotiate the protection of biodiversity, a multilateral convention on biological biodiversity at the UN, and all the quantitative goals on reducing the use of pesticides to protect biodiversity have been put aside quite quickly early on as being problematic, because it could reduce our capacity to produce food in large quantities without taking into account health-related issues for agriculture or food-related issues, nutrition-related issues. So we need to talk about the links between nutrition, climate, and other food-related dimensions. And in this international forum space, health wasn't a strong enough argument to reduce the use of pesticides. In Brussels, the Farm to Fork strategy is mentioning nutrition, nutritional health, agriculture's health, safety, and of course we need to produce more in times when Russia is declaring war in Ukraine. And yes, we need to protect agriculture's farmers' health and change our agricultural model, but also in the same time overcome the current crisis. It shouldn't work in opposition. So these were the two anecdotes I wanted to mention to see that, to show that at the European and international level, we need to create alliances between health stakeholders and environment stakeholders to change those environmental pathways. Christina talked about the climate resilience and development pathways, and we need to work on resilience. And what I heard a lot as well, both during the last session but all day long, is that science-based analysis are clear. The IPCC report on the health chapter is very precise. We need to protect climate and biodiversity. The benefits on health are going to be significant. To talk in concrete terms on these international disputes in Brussels that I mentioned, and I'm sure that you know about this if you've worked on the common agricultural policy, DG Health and DG Environment is trying to create an alliance to make DG Agriculture join this pact, this Common Agricultural Pact. So we talked about the co-benefits, we talked about alliances, coordination, but alliances can also be complicated and they can provoke a reluctance, and sometimes it's quite hard with sectorial policies. I have nothing against the agribusiness sector or agricultural sector, but it's a flagrant example of those kind of disputes and the fact that health is not always taken into account and placed at its core. Other things I heard today on political mobilization to be able to win those disputes in fine. And one of the key words were inequalities, social inequalities. Of course, when we talk about protecting climate, decarbonization, the reduction of the use of pesticides, but of course, we need to assess how it's going to increase food prices, energy prices, the impact on employment in the agricultural sector, in sectors where people are relying on steel, on coal, production of steel and coal. And in terms of public health, this is striking. We need to show the inequalities, the impacts on the most vulnerable ones if we don't act. If we don't protect climate, then the sanitary, the health impact are going to be very unequal, and we need to prove this. The exposure of the poorest to climate risks, to damages, pollution-related damages, and the fact that health public institutions must act on this, and we need to show the risks related to climate. And I talked about nutrition earlier. Let's say we want to change our consumption mode to change climate. Well, it's because the food model that we have developed at the industrial level with lots of void calories have impact on nutritional health, and this is impacting the poorest populations that have access to these affordable calories but that are not nutritive. So we need together to prove, to explain these arguments that we don't want to build pathways that are good for the environment but problematic for the social at the social level. No, we want to prove that at the social level it will allow it to make progress, and the environmental action will have a positive impact on health, on social health. All pathways are not as effective, but if it's well designed, then it can be positive. One last thing, and maybe some comments for the National Institute for Public Health. I think that health is a way of mobilizing citizens. So at the city level, at the regional level, cities are very important. We need to raise awareness among citizens, but to show them how they can act as well. Many citizens today say that they're convinced, and I worked with the citizens who were in part of the Citizens' Convention for Climate, and most of them said, yes, I want to act, but I don't have the means, I don't have the levers. And regarding issues that are connecting health, nature in cities, adaptation, mitigation, we see initiatives to mobilize citizens at the social level. There must be also a more collective and political mobilization. Of course, the responsibility doesn't just belong to citizens, but starts from the collective level. And I think that it's very useful today not to oppose individual actions to collective actions. I'd say that the actions of local authorities, actions from the grassroots level, is showing that this is a group of means allowing citizens to see that they're not alone. And health issues for this type of mobilizations are very useful as well. I think that, and I'm addressing this to the National Public Health Institutes, but I think that COVID showed that there are curative challenges and preventive challenges, collective actions to protect public health. I think that public health is not well known for citizens when they think about the doctors. Now public health has become much more of a daily issue, and this is what we can use to promote collective actions and to promote collective well-being. I think that thanks to these issues, we can build a striking political narrative, and I think that these alliances, National Public Health Institutes, are essential to share data and to encourage citizens to implement these pathways. Sometimes there can be political disputes that are coming in the way, and that were my observations. I think that maybe I come across as an activist because I work for a think tank, but we need to mention all these ideas. Thank you, Sébastien. We had a think tank perspective. Let's hear what Jean-Christophe Comboroure has to say. He's the Deputy to the Vice Director, Division for the Prevention of Environmental and Food-Related Risks, Director-General for Health. So we talked about farm to fork. So yes, we want more of this, farm to fork, and it's a health-related issue. And with the Ukraine crisis, I think that it is making it trickier. Indeed, yes, the action at the international, European level, national level, since I work for DG Health, for Ministry of Health, and climate change is a major challenge. So thank you very much for having organized today's conference at Santé Publique France, a conference that is taking place within the French presidency of the Council of the European Union. And so this will take place until June in France. Today's conference was rich, was fascinating. Exchanges were fascinating. We talked about the urgency to act and some concrete actions in the field, actions that are significant at the national level. And on Monday, the IPCC have launched a plea to take immediate actions, and I think that health is now integrated in this process. And this plea, this call to guarantee a sustainable future is at its core, and I think that it's time to act. And climate change is, yes, a determining factor of public health, also a factor of inequalities, and this is why we need robust health systems taking into account environmental challenges. I'll talk about the last 7 years and the impact on heat that were observed. 2021 was particularly hot during summer in the northern part of the hemisphere. So we saw that climate change does exist, and that people is now aware of it, being a victim of it. Measures must be taken to mitigate climate change and adapt to it. Otherwise, we will see an increase of morbidity and mortality, negative impacts on life quality during the next decades. The notion of life quality is essential here. Policies in order to decarbonize economies will have also an impact on health. Today's title is reminding us of this. Health is a lever for action on climate change. You were mentioning it earlier. Health is involving each citizen. However, crises such as health crisis and COVID, war in Ukraine and its impact shouldn't be a reason to ignore other threats such as climate change. In terms of health impacts, we know that extreme events such as heat waves are increasing risks of mortality and morbidity. We saw concrete actions today in Nutrition Athens. The risk of importing infectious diseases and vectorial disease is becoming higher and higher, and this has a direct link with the environment and the change of biodiversity. A comprehensive approach is implemented to strengthen surveillance. We talked about it this morning. Epidemiological surveillance, strengthening diagnosis capacity, antivectorial struggles. We saw the comeback of tiger mosquito, and in France, the challenges around healthcare, dissemination in environment, research challenges as well are very much present in France. One of the main challenges is prevention, and the goal is to strengthen social mobilization and health education for everyone to prevent the development of infectious and vectorial disease by adapting preventive measures and to limit risk. Prevention is also about communicating on these challenges. We can also mention air pollution with aggravation of asthma, of cardiovascular risks, especially for the most vulnerable, most exposed people. We talked about allergies as well, and pollination that is related to temperatures and rainfalls with an impact on the flowering periods, pandemics, a hotter climate that will trigger this and impact on health. And to finish, to strengthen prevention and face emerging risks, we need this One Health approach. It must be cross-sectorial to be fully effective. Transversal approach was highlighted. It is important. After having faced 2 days observations at the national level, France has a specific strategy to adapt to climate since 2011. Simultaneously, France has adopted its first national strategy, low-carbon strategy in 2020, defining a roadmap for France on mitigation and adaptation. These are guidelines to implement a transition to a low-carbon economy in all activity business sectors. This is essential, with targets to reduce greenhouse gas emissions for France, carbon budgets, 2 ambitions to be carbon neutral, zero net emission by 2050, and reduce French population's carbon footprint. Our national strategy is part of the 2 chapters of national policy. Second pillar on adaptation to climate change. defining the future French strategy has now been the goal, the purpose of projects in France. It will be the new roadmap, updated roadmap to reach carbon neutrality by 2050 in France and to make sure that our society is adapting to climate change. There will be a first law on the energy climate law. The national plan will be updated and revised, and there will be a multi-annual programming of energy. Challenges are numerous. First, climate emergency, but also integrating territorial actions, sectorial actions as well. We will need to translate this in a reduction of greenhouse gas emission, minus 50% net emission. There will be a direct impact on the national objective of reducing emissions by 2030 and will allow a significant impact on additional decisions. In order to accelerate these policies, the health sector must contribute to decarbonization, but also allow our health system to be resilient in the face of climate change. Digital health as well will allow to mitigate the impacts of climate change. Thanks to these public policies, the Ministry of Health is committed to fight against climate change and against its impacts on health. In 2020, the Prime Minister has asked 7 ministries to put in place an action plan for the Ministry of Health in order to strengthen the coherency of public policies, the commitment in France in terms of combating climate change. This is in progress. This will allow us to cover a broad scope to limit the impact of human activity on climate and environment. So this is the mitigation pillar, and also limits the evolution of emissions. There will be 6 challenges for this low-carbon national strategy. 6 challenges. 3 on mitigation, 3 on adaptation. So regarding mitigation, we'll need to renovate hospitality infrastructures, medical and social infrastructures to be made more energy efficient. This will become one of the priority actions. In the health sector, there will be a policy on sustainable development in medical infrastructures. Last summer, the Ministry for Health and the Environment have launched an appeal, a call addressed to all health and medical infrastructures to nominate advisors for these actions. These advisors in energy performance will have for mandate to accompany a number of establishments, institutions to reduce their carbon footprint. The national budget is of 10 million per year up to 2024 to encourage these recruitments. Food also is a lever. Health and sustainable food is also part of these pillars. The law on climate and resilience have introduced a new climate dimension on strategy for food, and this will be included next summer. Solidarity and social justice must also be at the heart of our attention to take into account the most vulnerable populations, the most affected populations. In order to protect the health of our population, we must put in place adaptation measures. We talked about examples to prevent heat waves, to prepare to heat waves, and this can be done at the national or local level. We had the example of Grenoble, for instance. This may be strengthened, adapted, depending on the challenges, the frequency of these heat waves. We mentioned it this morning as well. We consolidate alert systems, and climate change indeed will trigger changes on the environment and biodiversity that will have direct impact on human health. So we'll need to make sure that the risk of viral transmission are taken into account. Use of water as well. The Ministry of Health is very much cautious on this. Access to water, access to the water that is of a good quality, preserve resource in water. The Ministry of Health must be an example and will show that sustainable development is key. And today's building where we're hosting this conference is a real example of this. Regarding populations, the vulnerable populations, accompanying these transitions is also key to the Ministry of Health. The major role of national public health institutes to promote best practices in the health sector in terms of adaptation or mitigation to improve health and well-being in a changing climate. The International Association of National Public Health Institutes is playing a key role. This conference is a perfect example of this type of actions. Today, we heard the example of cities, regions in Utrecht, Athens, Grenoble. These are inspiring examples that must be shared. We must continue the collaboration of institutions with international organizations, regional organizations, civil society, citizens who are engaged, committed in public health and climate change. Let's make sure that health is part of public policies to combat climate change. This will allow us to assess our public policies. We'll be able to adopt a One Health approach. We've mentioned this several times. We need to make these challenges, these issues, cross-cutting. This is also key. Thank you very much for the invite and for today's conference. The exchanges were rich and the examples were very much concrete beyond a commitment at the national, international level. There must be examples at the local level. This is essential. Thank you very much.
Merci.
Thank you very much, Jean-Christophe. Okay, last word then to science. Laetitia Huiart, scientific director at the Directorate-General for Health. It's a 4:40, and we were supposed to kind of wrap up right now, but we're going to give you a few moments to science. Does this give you any hope, Laetitia, what you heard here today? That health can be and must be a driver to combat climate change? Before seriously answering you, I might start with a personal anecdote here. I'm a specialist for public health, and I have children. And some of them are going through teenagers. And, teens ask a lot of questions about what you're doing, who you are. For them, my job is a bit obscure. Say, okay, I'm a doctor, but I don't treat people. I don't heal people, don't help people. So I've used my daughters, who's closest to teenager adolescents. So I click on a computer and I have meetings. That's what I do. Sometimes the radio says Santé, publique France, and that becomes a bit concrete then. We count the number of COVID cases, and that's concrete too. That can be useful. Don't know, maybe not. And then we don't let them eat the fun stuff they want to eat, maybe for nutritional reasons or maybe health alerts or whatever. But so my job isn't all that appealing, and we, don't enjoy my job too much lately. But this morning, things were a bit different. We were talking about the day, what we were going to do. We were talking about climate change and so on. And I saw eyeballs open up. And my kids thought, well, hey, maybe what we were doing had some usefulness for public health. We'll talk about it tonight. And we'll see. But this morning, things were different. And I think it's different because this means something. It means it makes one proud. I mean, what we did today, I'm proud. Maybe it's useful, especially in people's perception and first and foremost, kids' perception. So that, to me, is important. So what youth wants from us, and I think this was said this morning, they want concrete actions, and every day. I think that's what the youth are telling us. And they'll frequently check up on us too, and they'll be asking us for answers to be accountable. Some people brought some nuances to the time frame. Maybe it's not right now, right away. Maybe it's not absolute urgency. Maybe it's relative urgency. But if we look at what was said and the anxiety expressed by the youth, it's not even anxiety, it's distress, it's desperation. But I think that you have to realize, you have to conclude that you can't wait, we can't wait. It's right now, it's urgent. Our health and well-being that has to be negotiated in the public sphere is what our children are dictating to us. It's anxiety, it's desperation, it's distress. This is what I would bring to today's debate. But beyond that, as us, we are the France Publique Santé, Publique France. We're a public health agency. We talked about shifts in society. We talked about that society changing. But what we saw was acting is the simplest choice. And the other choices have no purpose. This is the choice. Acting is the choice that enables us to move forward for our youth and also benefits for health. So do we actually have any other choice than acting, taking action? We don't. So that's really important. And the COVID pandemic came up several times in the discussion. We learned so much from it. We learned something extraordinary. We learned that for health, we were able to have worldwide extraordinary actions that changed everything, that impacted the economy, that impacted so many things, and the normal barriers that are thrown up, well, we were able to get beyond them in certain conditions. So there's that potential. It's there. But we also talked about the fact that, well, we can't have only action for health. There were balances that we had to find between health and wealth, and these were very important things to be taken into account to produce benefits for health. So our responsibility as individuals and public health actors, stakeholders, our responsibility is huge in this setting. We have to reduce, we have to be exemplary, we have to work on our emissions, we have to improve our environmental footprint, but we also have to put this at the center of all of our actions. I didn't say preoccupations or concerns, I said actions. So should it be one of our priorities, one of our institutional priorities, or the institutional priority? I don't know, but to promote and protect the population's health, perhaps the current debate is the problem that very topic is not the center, the heart of our priorities. So we have to contribute to moving forward the political agenda, and I think some of the talks and even the conclusion show how difficult it can be to drive forward the political agenda, and how important health issues are on this agenda. We have to contribute to public policy through science. We're scientific agents. We have to be documented. We have to understand. We have to evaluate, quantify benefits, offer solutions. And this advising for the greenest healthy choice is probably one of the most important elements of it all. We see that the IPCC's elements give us concrete elements in the talks and their ability to change and impact health. We saw some very inspirational examples from municipalities here and far away, and political engagements that were shown by our colleague Tracy and the representative from our DGS. We have to train actors. We have to support other organizations. We're not alone. Just like in COVID, we're all together in this momentum. We have to work continuously and relying on stable institutional players to not be pushed aside for certain priorities on certain agendas. Second point that sticks in my mind is we have to change the way we work. It's also important to have a broader vision, to understand, to recognize the interconnection of all the systems in this One Health viewpoint. We have to work on that on a daily basis. The intersectorality, interdisciplinary. We didn't hear the word multidisciplinary today. We heard interdisciplinary. It's a similar concept, though. And this via multiple actors and stakeholders in a continuity of actions. We have to reinforce it. We have to share our know-how. We have to grow this further. We developed this during COVID, and we saw that during COVID, all of the issues at stake in terms of logistics and many other dimensions, that the healthcare was the focus of what we were doing, and we succeeded in certain areas. So this intersectoriality was mentioned, illustrated by the people here today who spoke and who showed the various aspects and the various elements that we can put into play together. Different scales, different echelons, so worldwide, the small village. Our planet is a small village, all the way down to the smallest level, which is what? The finest level is what? People, individuals. And what we see is we don't know where the actual right action is. It could be the town, committee, community, municipality. This is where it's the most fluid to be able to implement actions. And as agencies, we're very interested in these territorial activities where we break them down into the lowest levels possible, and hopefully it trickles down. There are opportunities that we can't miss in changing the way we work. Traditionally, we work on risks. We have a lot of people working in epidemiology, lots of agencies working on risk factors, individual risk factors, community risk factors, climate change. It's really not the risk or the risk factors. It's to have a systemic way of acting, way of working, creating favorable environments favorable for health, dealing with mitigating climate change, endemic, pandemic diseases, infectious diseases, so on and so forth. Everything, it has to be global. A third element, I think, we have to influence research agendas, and that's a major issue. We see all the project, we see all the data that exists, we can convince, we can win over. We're not questioning climate change. We're just questioning how we're going to best deal with it. But we have to support and contribute to defining research agendas on these issues to identify gaps, because there are gaps. But we have to also compel action and actionable knowledge so that we can have concrete solutions, concrete results. Science and research have to help us work in integrated analyses of climate change and being able to adapt public policy for mitigation. So this is fundamental to be able to move forward on a common roadmap based on One Health or planetary health. I mean, we can talk about you can discuss and debate the semantics, but it's really all the same idea. We have to keep the focus on this, as I'm assuming we did, at least that's what the pandemic, COVID, taught us, that we have to, all these issues of equity. So equity is fundamental. And we've seen the impact and the diversity of the impact on society based on people's characteristics and their vulnerabilities. So we have a key role to play in translating science into public policy and into practice. But I think that's what this whole day illustrates, and this is what we shared today. Of course, we're going to continue our research, our work at SPF, and it's a major facet of what we do. And of course, at INFI, where we have the committee, where we'll be developing, growing a defined place for these topics. And I would also like to thank, of course, all of our speakers today. were incredibly interesting and inspirational, who were able to talk to us. And I'd also like to thank all of the participants. We had over 1,500 connections. And sometimes, okay, it wasn't easy for everyone because we had some technical issues, and I apologize to everyone for that. But I thank everyone who participated in this event with us. And I would also like to thank the teams who were able to make all of this possible, content-wise and organizationally, and those who helped us through this day and put it together, and will carry it beyond today, because this day is just one day amongst many. And I repeat that every evening at dessert, I get questions, so I have to tell my kids what I'm doing. So I would like to thank the president of INFI, Duncan Selby, who contributed substantially to today, and John Newton, the president of our scientific committee, who's with us here today. So thank you all very much.
Merci, Laetitia.
Thank you, Laetitia. Well, that's the end of today, and a whole day where health was at the focus of what we're doing as a driver for action. That gives us hope. So thank you to Santé publique France. Thank you to the French presidency of the European Union. And thank you to all of you here present and out there connected. And so your task now is not over, because you have the hashtag SP France L'Amphi for climate. And you have to share this across the world. So hashtag SP France, hashtag INFI for climate, hashtag for climate, or you can go with all three of them together there. And resources, of course, on the platform that you see online there. And in a few days, well, you'll have all of the PowerPoints and all the slides and the videos available that were shown here today. So keep that in mind. I think that's it. I'm Chris Burns. Goodbye, and until the next time. Thank you.